Hi, everyone. Thank you for joining us for our March Lunch and Learn during Brain Injury Awareness Month. Today, our guest speaker is from Oregon Health and Science University, OHSU, and talking about brain health.
All right. Hello, my name is Kayt Zundel. I'm here with Oregon Health and Science University. I work for a injury prevention program called Think First Oregon, and we are part of a national nonprofit, which is called the Think First National Injury Prevention Foundation. I have been the program director of OHSU Think First for the past 14 years. And here is my contact information if you would like us to do a presentation or if you'd like any more information. All right, I'm just going to briefly show a few pictures of what your brain does. So this is a side view. Your frontal lobe is responsible for decision making, emotional control, problem solving, organizing, memory, and planning. Your temporal lobe is your hearing, speech, and memory. Parietal lobe, sensory information, sensation, touch, and pain. Your occipital lobe is your visual information, perception of shapes and color. And the cerebellum is your balance, movement, and coordination. Now, your brain does a lot more things than what you're seeing right here. This is just a little bit of what it does, but it will give you kind of an idea as we continue on. All right, so the brain stem is the last part we're really going to talk about. And this part of your brain connects to your spinal cord, and it's responsible for your breathing, your heart rate, your blood pressure, your swallowing. It's responsible for all the things you don't think about. So, what is a traumatic brain injury? A traumatic brain injury is also called TBI, and that is when a blow or jolt to the head or penetrating brain injury disrupts the function of the brain. Mild TBI, otherwise known as concussion, is caused by a bump, blow, or jolt to the head or by a hit to the body that can cause the head and brain to move quickly back and forth. This means you can get a concussion without actually hitting your head on the ground. The sudden movement can cause the brain to bounce and twist in the skull, and there's lots of chemical changes that takes place in the brain. Your brain is unique to you. Our brain communicates using electrical impulses, and all kinds of chemicals are at work in there. When you get a concussion, everything goes offline for a while. The chemicals flood your brain, similar to when people have seizures. There's stretching and shearing and damaging to the brain cells. And these changes in the brain lead to symptoms that affect how a person learns, thinks, feels, and acts. Now, in the past, probably pre 10 years ago, people were under the impression that a concussion wasn't that serious. But we have learned a couple of things. Concussions are cumulative. Each one will be greater than the one before. It will cause more, it will take longer to heal, and it will be worse than the one before. We've also learned that concussions don't always heal in just a couple of days, that it can take weeks, months, and sometimes your concussion symptoms don't show up right away. They may be delayed and they show up a few weeks later. So 75 to 90% of all brain injuries are concussions. And most concussions, a majority of them are not reported. What is a concussion? Well, if you lose consciousness that is less than 20 to 30 minutes, it's most likely a concussion. Again, you always have to get diagnosed, but you can lose consciousness for a few seconds or a few minutes, and that is still most likely going to be a concussion. And that's after you receive a hit to your head. Recovery generally takes place within days or weeks, but it can be longer. We found a small percentage may have long-lasting problems, and especially people who have cumulative concussions. They've gotten them when they're younger, and they are cumulative. Each one is worse. So what is a concussion? A concussion is a type of traumatic brain injury Caused by a bump, blow, or jolt to the head or by a hit to the body that causes the head and brain to rapidly move back and forth. And this can cause the brain to bounce around or twist in the skull, and it creates chemical changes in the brain and sometimes stretching and damaging brain cells. So, when these chemicals flood your brain, it is similar to what happens with a seizure, and everything goes offline and may not work like it did before. So, again, it's going to temporarily change the way your brain works. Concussions generally do not show up on CAT scans or MRIs. These results show up as being normal. So, how concussions occur? The brain is a soft organ. It's protected by a skull, but it's floating in this cerebral fluid. And the fluid cushions the brain and keeps it normally from crashing in the skull when you're walking around. But when your head is hit hard, it can hit the skull and that results in injuries. So this is just a little visual of what happens to your brain. That's called a coup. And that's when your brain impacts the front part of your skull. A contra coup is when your brain impacts the front and the back. So you're having injury to both parts of your brain. And then we're going to now move on to moderate and severe TBI. So there's two kinds of injuries that are often talked about, unintentional and intentional brain injury. So unintentional, this is a classified, and we can, argue about intentional, but this is just for purposes of trying to understand where these statistics come from. So unintentional causes of moderate and severe TBI are mainly motor vehicle crashes, and motor vehicle crashes actually. And falls are the leading cause of TBI related hospitalizations among Americans, especially older adults 75 years and older. And again, motor vehicle crashes happen. Intentional in the United States, firearm related suicide is one of the top causes of brain injury and death. And then following that closely is assault. So these are considered more like intentional injury. Moderate TBI is 8 to 10% of all brain injuries, and this you lose consciousness but less than 6 hours. In 3 months, two-thirds of the people with a moderate TBI have not returned to work, and 30 to 50% have ongoing residual problems. Severe TBI is less than 10% of all brain injuries. This is loss of consciousness 6 hours or more, and long-term impairment is common. And the percentage of patients that fully recover when they have a severe TBI is 0. There is never a complete recovery. They will always live with some kind of ongoing damage in their brain or this injury that cannot be fixed. So potential effects of a traumatic brain injury, your cognitive function means thinking is affected. So you have memory loss, impaired judgment, difficulty concentrating, and difficulty communicating. Motor function, extreme weakness, impaired coordination and balance. And then sensation, hearing, vision, impaired perception, and touch can be affected, as well as your emotions, depression, anxiety, aggression, impulse control. That means the ability to stop yourself before you say something or do something. And personality changes can occur with a traumatic brain injury. Some misconceptions of traumatic brain injury. So here is the first misconception, which is a young child's brain can heal easily because the part that may have been damaged is not yet fully developed. People really believe this, but the truth is a younger brain is far more vulnerable to damage because it is not yet um, fully grown. It is still developing. Although the brain of a child is more capable of regeneration than that of the adult, it can also be more permanently damaged. It makes it difficult to really predict how the brain is going to develop. Some kids who have started out with brain injury, they've tracked kids who have had concussions playing in middle school, football. And what they have found is they've tracked these kids that with each concussion, things are impacted like their ability to learn in school and to remember. So there are some really interesting studies that are worth taking a look at. A concussion is a bruise on the brain that can be seen on a brain scan. This is false. A concussion is disruption to the normal functioning of the brain. Concussions generally do not show up on MRIs or CT scans. So if you have a concussion and someone does a brain scan and they say, "Oh, your brain scan is normal," it does not mean that you don't have a brain injury. It means that you do not have bleeding on the brain or something that can be spotted with these scans. But you can still have a concussion and it's still any brain injury is serious.
I'm not sure I understand.
So the second thing to really understand is recovery from a brain injury is believed to take about a year, but the actual truth is recovery typically means someone has lost abilities temporarily and will regain them. For a person with a brain injury, although they may look the same, changes are more likely long lasting and adjustment is ongoing process. And again, remember the percentage of people with a severe TBI who fully recover from their brain injury is 0. And misconception 4, every person with a traumatic brain injury will recover at the same rate. And the fact is that recovery rates differ from the person to person due to things such as severity and location of injury and functional status before injury. Misconception 5, the adverse effect of TBI are seen immediately following the injury. And the facts are that approximately 15% of people who do not initially show these signs of TBI deteriorate later due to secondary injuries from slow accumulation of blood, delayed brain swelling, and delayed seizures. So you do not always see those effects right away, even with a concussion. So it's really important to follow up with your doctor, to get checked out, and to monitor closely how you're feeling and how you're doing. So some of the statistics, 5-year outcomes of persons with TBI, 22% died. And again, this is based on US populations. 30% became worse, 20%, 22% stayed the same, and 26% improved. So what we really want is to not get a brain injury. And there's things you could do to prevent this, simple things like buckling up in the car the correct way, um, not speeding your car. Speeding in a motor vehicle is a very high rate as a cause for crashes. And again, traumatic brain injuries occur in car crashes. 1.7 million sustain a TBI annually in the US. 5.3 million Americans are living with TBI related disability. Now, this number is much larger now. This was about 5 years ago. So the numbers have increased. This is a little older data. TBI is the number one cause of death and disability in children. And again, we talked about the majority of TBIs that occur um, being concussions. The direct and indirect cost of TBI in the United States as of 2019 was estimated to be $76 billion annually in the United States. Now, 5 years ago, when I did this presentation initially, the indirect costs were estimated to be 36 billion. So if we're looking at that, it is more than increased by more than 50%. Now, these numbers come and go. These numbers are just an idea and they're changing all the time. But causes of TBI in children ages 0 to 14, 50% were falls, 24% struck by or hit against an object, 6.8% motor vehicle crashes, 2.9% assault, and 15% unknown. Falls are a major cause of traumatic brain injury in older adults. So based on the most recent data, you will see that in 2019, we had an amazing rate of TBI-related hospitalizations, as well as TBI-related deaths. Now, TBI-related hospitalizations, if people are having an opportunity, they get a terrible brain injury, they live. The ongoing care for moderate or severe brain injury is going to cost a huge amount of money for the rest of their lives. In 2020, more than 611 traumatic brain injury related hospitalizations happened per day. 176 traumatic brain injury related deaths happened here in the United States per day, and that was again in 2020. And these estimates do not include the many traumatic brain injuries that are treated in emergency departments, primary care, urgent care, or those that go untreated. These are actually people that were admitted to the hospital or passed away within the hospital, so they were treated, admitted. So there's, if you can imagine, the numbers probably so much larger than what we're even seeing here. So who is dying? So 75 years and older. So adults who are 75 years and older were the highest number of people dying from traumatic brain injuries. And most of these traumatic brain injuries came from falling. So 65 to 74 years. So this is just kind of showing the order. Mostly it was people who were older than 75 years old, then it was people between 65 and 74, and then 55 to 64-year-olds. So you can see it's very large. So 24% of the 65 to 74-year-olds had death due to a traumatic brain injury, and then 19.5% of 55 to 64 years old, and that was in 2018. Population's highest rate of death. So this is looking at the population as a whole. It's not necessarily related to the number, but comparing it to the whole number, the whole population, and then the percentage of that. And what they found was American Indian or Alaska Native, non-Hispanic persons were the non-Hispanic person's highest rate of TBI related deaths. So American Indian or Alaska Native had the highest rate of deaths in 2018 and 19 related to traumatic brain injury. And the top 3 causes of unintentional traumatic brain injury: falls, something being struck by or against, and motor vehicle crashes. This is 2014, but these numbers have again gone up. We have a couple of different numbers and they have all increased. Here's just a quick view of causes of traumatic brain injury in kids that are 0 to 14. And then just kind of showing you, we've gone over this a bit, but again, adults 65 and over, 81% of their ER visits were related to falling. And then motor vehicle crashes leading to traumatic brain injury were very high for people 15 to 24 in age, 24 to 34 in age, and 75 years and older. So just briefly, I'm going to talk about the common types of brain injury, and we won't go into this a great deal, but just so that you have kind of an idea. So there's a closed head injury, and that means the skull is intact. Rotational forces cause shearing, and bleeding the brain and swelling may occur. So your brain is moving, it's hitting the skull, you have your neurons and axons, neurons are shearing or breaking. There's also something called CTE. They have found that people who have repetitive history of brain injury, including concussions, can end up with a degenerative disease of the brain. And this is very common in people who play football, who are boxers, and even soccer players. And that is something to help understand why it's so important, even with concussions, to take care of them, to understand their cumulative and you only get one brain. You really want to take care of it. So again, we know a concussion is a mild traumatic brain injury, but that doesn't mean it's mild. And post-traumatic stress disorder, PTSD, military signature injury of a mild TBI, we're finding more and more that in the military, many people have brain injuries that have gone unreported or they didn't even know about it. So that awareness is really beginning to um, make itself known. We're beginning to understand more and more about brain injuries that occur when people are in military service related to what they're doing that we didn't know before. And again, sometimes they diagnose it at post-traumatic stress disorder, but the truth is they've had a brain injury. There's also post-concussive syndrome, and this is after you've had a concussion, you're going to get later signs of the concussion, and again, there's going to be concentration deficit, you're going to have short-term memory impairment, irritability and depression, and decreased processing speed. All of this happens after you've had an incident occur, so it would be something different from what your normal is. Fatigue and sleep disturbances, I just need to get a quick drink. All right, fatigue and sleep disturbance is pretty common. Headaches are pretty common also. Second impact syndrome, injury prior to recovering from a concussion from a previous head injury. It may cause swelling from loss of normal control of blood flow to the brain. It is rare but deadly, more common in teenagers, if not fatal long-term effects similar to severe traumatic brain injury. So second impact syndrome means that you have a concussion and your brain gets a second injury. You hit your head or your brain again before it's healed, and it can cause swelling of the brain. And when your brain swells, it has nowhere to go. And so this is what can cause death. So very important to just be aware and really advocate for recovery. So second impact syndrome, again, the first TBI makes the brain more easily injured because it is going to have slower reflexes, it's still healing, and prevention is the key. Don't let people return to play in sports, even if they say they're fine, and make sure that the evaluation is being followed. We have lots of laws and guides in place here in Oregon, and it's really important to follow those. Recovery from concussion, 80% of concussion recovery takes place in 2 weeks. Average recovery time for youth is 3 weeks. Loss of concussion is not, you don't have to lose consciousness to have a concussion. You don't necessarily diagnose concussion only if you've lost consciousness. There's lots of symptoms. Imaging is not usually helpful, and to recover, you want to avoid screen time, noise, and light. All right. We'll just go over briefly a few more of these and then we'll wrap it up. A cerebral contusion is bruising to the brain. A brain contusion causes areas of localized brain swelling and tiny zones of bleeding within brain tissue. So this is just kind of showing you the mechanism of a closed head injury. We saw the little video of how your head hits forward, it's thrown forward, and your brain moves and hits the skull in the front, and then it hits the skull in the back. And this is just a little picture. You can see the dark spots here. These are just the most common site for contusion. Diffuse axonal injury. Injuries are to axons located throughout the brain. Injured axons may release chemicals which can increase swelling of the brain, and this includes concussions and may be difficult for doctors to initially assess. Now, if you're an older adult and you have a fall and you have a hip injury or you've broken something, sometimes your brain injury can go undiagnosed because you have a more severe injury that they're looking at that can be seen. So because your brain injury can't always be seen, it can be misdiagnosed or overlooked. So you've got to really advocate for yourself. Subdural hematoma. This is when blood accumulates within the space between the brain and the tough, leathery outer covering called dura. And subdural hematomas in children and adolescents are usually abrupt and are brought on by accident or injuries. So super important to understand. And then this is just a little more collection of blood accumulates within the space between dura and the skull. It's generally caused by trauma to the head. The prognosis of recovery is much better because it's outside of the brain, and it's often referred to as talk and die syndrome. So then we also have objects penetrating the brain, and the skull may be fractured on impact, and this is more susceptible to infection within the brain. So prevention, super important to remember all the things your brain does for you, um, and really value it. To prevent your brain injury, it's important to report when you get an injury, to understand that although the brain injury may not be visibly seen, like a broken arm or a contusion or cut, or stitches, it can be far more serious. So really important to be aware that the best way is to just prevent your brain injuries, to be aware of how important your brain is, and if you do get a brain injury or you hit your head, that you report it. Thank you so much. If you have any questions, please feel free to contact me, and I hope you have a great day.